Welcome to Dr. Balaga's podcast for the curious doc. Today is July 4th, 2026. This video is on the Great Doctor series on the Greek physician Soranus of Ephesus, who was known for methodology in medicine and midwifery. He was a clear-thinking Greek physician whose writings helped preserve classical gynecology and practical medicine. He was from Ephesus, practiced in Alexandria and later in Rome, lived during the reigns of Trajan and Hadrian, roughly 98 to 138 Common Era, was a leading representative of the Methodic school of medicine. Methodic doctors focused on recognizable patterns of illness. They grouped conditions into broad types rather than chasing every hidden cause. The treatment depended on pattern, stage, and whether disease was acute or chronic. 3 disease patterns: status strictus, body passages of pores considered too constricted; status laxus, the passages were considered too relaxed; and status mixtus, with features of both. The treatment was aimed to restore balance through physical and dietary methods. He was a different kind of doctor. Soranus respected earlier physicians rather than mocking them. He studied their writings carefully. He quoted sources with unusual precision for his time. His style is clear, simple, and not overloaded with rhetoric. Why we know him? Many of his writings survived in Greek or Latin translation. His major surviving work is 4-volume treatise on gynecology. A Latin translation preserved his work on acute and chronic diseases. He also wrote on bandaging, fractures, hygiene, pharmacology, surgery, and medical biography. Gynecology and midwifery. His fame rests especially on his textbooks of midwifery and gynecology. It described qualities of a skilled midwife. It covered female anatomy, menstruation, conception, pregnancy, childbirth, and newborn care. It became influential for centuries. The skilled midwife. Soranus valued knowledge, skill, calmness, and character. He emphasized practical care rather than superstition. His work described examination, labor, difficult births, and care of the mother and infant. Practical medicine. He cared about what helped the patient. Treatment could include diet, surgery, pharmacology, and physical therapies. He wrote for practitioners, not just philosophers. He believed medical knowledge should guide action. Bandages and surgery. Soranus wrote a manual on bandaging. Ancient illustrations showed techniques still recognizable today. His principle was elegant. The best bandage is the simplest one that stays in place. Beyond practice. Although methodic medicine often downplayed anatomy, Soranus found it interesting. He wrote on anatomical and physiological terms. He also explored causes of disease as a way to deepen medical understanding. Reputation and legacy. Ancient writers praised him highly. Augustine called him a most noble medical authority. Tertullian described him as a highly trained methodic author. His work influenced medicine through late antiquity and the Middle Ages. Why Soranus matters today? He organized medical knowledge clearly. He emphasized practical care, classification, and careful writing. He preserved knowledge from earlier physicians. He helped make women's health a serious medical field. Take-home messages. Soranus teaches us that great medicine needs clear thinking, respect for evidence and prior knowledge, practical skill at the bedside, compassionate care for mothers, infants, and patients. This is an infographic on him. Hit pause and read at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.